Well, good afternoon and welcome to H360 Live. My name is Dave Duplay, and joining me here in the studio today is my colleague from Healthio360, Cortland Long. Hi, Cortland.
Hi, Dave. How are you?
I'm doing great. What about that event we went to yesterday? Pretty good.
Oh, that was a great outing, a really awesome fundraiser.
Yeah, the Michael Magro Foundation. Yep, raising awareness for blood cancer. It was fantastic.
Yeah, it was great. We were really lucky to have Delete Blood Cancer with us.
Absolutely. Well, we have a very exciting show for you today. We have Linda House coming into the studio in about 5 minutes. Linda is the president of the Cancer Support Community. They are doing some fantastic work for patients and caregivers going through the journey of cancer. We're going to hear all about the work that they're doing. But first, before Linda gets here, we have a very interesting article that we came across over the week, and we want to share it with you guys at home today. And that article was What to Do When Life Doesn't Go Your Way. And actually, the article suggests that that may be a good thing, believe it or not. You know, Cortland, we've all kind of been there, right? Our dream job doesn't go exactly like we thought it was going to go. We may end a long-term relationship, or things just aren't going like we want them to. And, you know, people seek out for many reasons a life coach, but primarily because they want to change. It's all rooted in change. So they seek out a life coach and they try to improve on themselves. And this is really at the heart of this article, which I found very interesting. And so if that happens, Cortland, where does one begin?
Well, even before we can get to these 3 steps that the article suggests, we need to embark on quite a bit of self-reflection. So asking ourselves, what does success look like to me, or what makes me happy, really will help you get started on these 3 steps. And being honest with yourself in answering these questions, it's very easy to fall into the conditioned responses of what you should want. So the very first step is to give yourself a break. You know, all too often we focus on what is lacking in our lives, and we fail to acknowledge what is going right. So check in with yourself in this way and realize that there's actually a lot of awesome things probably going on in your life.
Yeah, you know, it's like that saying, check yourself or wreck yourself.
Yes.
You have to check in. You have to give yourself a break, right? But the point is you have to have a truthful break. You have to really examine what's going on and focus on the positive things that are happening around you.
And starting with what is working is the foundation for attracting more positivity into your life. So the second step is to tell a different story. You know, everything shows up for us based on what we believe that we deserve. And nothing is more preventative in moving forward than being stuck in negative thought patterns. And, you know, Dave, I noticed that this is a trend coming through in all of our articles and health tips, in that, you know, breaking free from these negative thought patterns is the first step of moving forward into positivity.
Yeah, you know, I think the article also suggests it's the people you hang out with, right? If you hang out with a bunch of Debbie Downers, what's going to happen? Well, you're going to be a Debbie Downer, right? If you hang out with people who are positive and upbeat and you know, have positive energy, that's going to, you know, rub off on you, and you're going to act that way as well.
Yeah, so that goes back to an article we had a little while ago where, you know, people just have a positive mindset, and they don't necessarily have any secrets to their lives, but they can still somehow get through the day. Even though they've spilled coffee on their shirt, you know, they can lead that meeting with, you know, a smile and confidence. It's really amazing.
Yeah, well, you know me, that happens to me all the time, the coffee on the shirt or something, but life goes on, right?
Yes, yes.
We've got to continue on.
So
is there more?
There is more. So the third one is get busy. You know, life is never 100% in our control. You think about everything that affects your life, from the traffic, the economy, weather, to even who your parents are. There's only about 20% of your life that you can control, but you can dedicate 100% of yourself to that 20%.
Yeah, that's interesting. It's the old 80-20 rule, right?
Right.
But imagine this. So only 20% of the things in your life you can control. This is what the article suggests. And if you take 100% of your time and focus it on that 20%, imagine all the good things that are going to come of that.
Exactly. You know, the future is created in the present moment, and what we do today matters.
Absolutely. So, Cortland, if we're going to sum this article up for our audience, what's the nugget here that we should take away?
Well, you can dwell on what isn't going your way, or you can focus on what you have the power to control.
So, yeah, absolutely. Focus on the things you can control, right? Give yourself a break, tell a different story, and the 80-20 rule.
Right.
Right? So focus on 100% of your attention on the 20% of the things you can control, and I guarantee you you're going to live a happier life. If you think so, please tweet us, chat it. It's to the right. Hashtag real stories in doing so. Well, Cortland, you know, we sent the summer interns out on the streets of Manhattan to see what the opinionated New Yorkers had to say about giving yourself a break, telling a different story, and the 80-20 rule. You want to watch?
I can't wait.
Okay, roll the tape, guys.
In your mind, what does success look like to you? Happy, being in love. I have the most beautiful wife in the world right behind me.
When you've tried really hard and you finally accomplished it, and it's like everything, like all the money and time and effort you put into it, and it finally pays off, that's what success is.
Living comfortably, having a family, like a big home.
Doing what brings you joy and whatever makes you happy.
What brings you joy in life? Good food and good people bring me joy in life, yeah.
I told you I work with kids who have autism. The little things that they do give me joy because, you know, kids who have autism, as much as I think I like to teach them, they teach me so much more.
What brings me joy is knowing that I did something unintentionally and it made somebody else happy.
Being around friends and family, I think, is the greatest thing.
How often do you give yourself a break?
Never.
Never?
I have not given myself a break in like 2 years.
Maybe 3, 4 times a week. I work out of the gym, you know, do stuff like this, you know what I mean? Yeah, maybe 3 or 4 times a week.
Every day, like at least 2 hours, just like laying in bed doing nothing. Try to relax. Yeah. Or working out is also like my break to me.
Probably less than I should. I probably should give myself more of a break.
And then have you ever had a setback and any lessons you've learned from that?
Yeah. I'm a recovering alcoholic. I have been sober for over 25 years. Thank you. And I'm grateful every day that I was able to put my addiction for today behind me.
Minor setbacks in school, that sort of thing. And I've just kind of worked around it and learned from that experience and moved forward.
I had a really big one, I guess, in relationships, but the only thing that you have to learn is stay positive, be happy, and just know that you're important. You're always important.
With setbacks in life, I feel like they give me the opportunity to learn, like, I am strong enough to, like, continue and better things will come.
Right now I got no idea. Wish I could just disappear.
Well, Cortland, what did you think of that?
Oh, I loved that video. People's reactions were really awesome.
Yeah, New Yorkers never disappoint, right?
No, they don't. And it was really great to see that although people have had some hard knocks, they've also maintained a positive attitude.
Yeah, there were some lessons learned.
Definitely.
Right? It sounded like that. And what about the lady that works with the autistic children?
Oh, they teach her something new every day? That's awesome.
Yeah, it was a fantastic video. If you like the work that our interns are doing, please, we want to hear about it. It's to the right. Hashtag real stories when doing so. Well, now is our favorite time of the show. Our guest, Linda House, is going to be joining us. So I want to go through a couple of things about her organization as she makes her way into the set. The Cancer Support Community is the largest professionally led, not-for-profit network of cancer support worldwide. And that's important. It's a worldwide organization. The Cancer Support Community team is doing some amazing work by bringing patients and caregivers support services and programs when they need it the most, and that's when they're going through the cancer journey. Also, they're involved in research and training, as well as working with local and state and federal politicians on policy and advocacy issues. Last but not least, they have an incredible network of international affiliates that offer the highest quality emotional support to patients and caregivers. Linda, thanks for coming in today.
Thank you so much for having us.
Came all the way from D.C. We ordered perfect weather for you.
You
How was
did.
the train ride up?
It was great. Thank you so much.
Well, you guys are really doing some fantastic work at your organization, and I'm so happy to have you here. Let's just jump right in and get started because there's so many things that we want to ask.
Great.
Well, Linda, I want to second what Dave said about you and your organization doing some really great work. And for our members who maybe might not know, the Cancer Support Community was started by a merging of Gilda's Club and the wellness community. So can you tell us a little bit about the mission of your organization?
Sure, and the history of the organization really sort of lends itself to where we are today. And you're correct, the organization was founded over 30 years ago in Santa Monica, California as the wellness community. And at the time it was really founded as a place where people could get away from their site of healthcare to find a place of healing and empowerment. And Gilda Radner actually went to that founding wellness community for her support and care as she was going through her experience with cancer. In 2011, the two organizations did come together and created a huge network that is now 170 locations where patients can go and receive care and support and education. And it really helps us fulfill our mission, which is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And those three, I would say, mission elements are how the organization is organized today and how we deliver the work that we do.
Wow, it's so refreshing to see an organization with a clear mission, which is understandable and measurable, right? Because at the end of the day, it's the patients and caregivers that we're all serving.
Correct.
And so that's a fantastic mission. Now, I know that you have really 3 areas in your organization that you focus on. And one is programs and services. The second is research and training, followed by policy and advocacy. Let's start with the programs and services, because I think that's really the area that our members and our viewers are going to be most interested in. So let's start with that, and we'll go from there.
You know, a lot of our patients and caregivers talk to us all the time about the poor quality of content that they're finding online. Some health event comes to their life, they turn to Dr. Google and they're scared. You know, so I know you guys have a program called Frankly Speaking About Cancer. Can you tell our viewers a little bit about this program?
Sure. Interestingly enough, Frankly Speaking About Cancer is our oldest brand. Now, with the merger of the two organizations, it is in fact the oldest brand, and it was established many years ago to bring good quality content to people who are just facing their cancer journey. So it is now delivered in a number of ways. We have content online. We have a weekly radio show that we would encourage your viewers to visit. It's housed on Voice America. We also have converted content into ebooks, so people can download the content on their iPads or whatever e-readers, the Kindles, whatever e-readers they're interested in. And we continue to grow that program. We are specifically using data from the research that we do to understand what patient needs are relative to content. So we're actually pushing out content and information through Frankly Speaking About Cancer based on what patients and families are telling us they need, which we're really excited about.
Yeah, Cortland's so right. The internet, there's so much misinformation out there. We hear it every day. And, you know, especially in the area of cancer, it's such a personalized almost treatment, right? It's very individualized. And so somebody goes to the internet and they get a broad brush stroke of, you know, cancer, and all of a sudden there's all that misinformation. But I'm also curious, you have a program called Open to Options, and it really focuses at the individual treatment for patients and their caregivers. Can you tell us a little bit about that?
Sure, you're right. So Open to Options is a shared decision-making process. And, you know, just to step back a little bit about the internet, you know, one of the things I tell people who are newly diagnosed or still in the process of becoming diagnosed, don't go on the internet. And I say that because it's sort of the natural instinct of, oh, I think I might have, therefore I'm going to learn everything I can. It's so important to know what it is that you have before you learn everything that you can. And to your point around personalized medicine, a diagnosis of breast cancer isn't a diagnosis of breast cancer. There are, you know, molecular bits of information that we need to know about that particular type of cancer, if you will, that will really factor into the decisions that people have to make down the road. So now moving to Open to Options, what we do is we take patients and families through a 40-minute session to help them really understand what it is that they want as their goal of therapy when they think about their cancer journey, and match that to what treatment options are being offered to them, so that we can then send them back into that healthcare conversation with a customized list of questions or a customized agenda, if you will, so that they can have that informed conversation with their physician. And what we find is that when people go through that exercise, which really is a lot of meaningful work to really identify their goals of therapy far and above anything else, they come away with a more satisfied opinion of their interaction with their healthcare team. They have less decisional regret. They are more well informed and actually get further along the process of things like a clinical trial as a part of their overall journey than they would have been without that program. And what's even more important is that we did a study with physicians to see how they felt about this particular program and the way in which patients now revisited their conversation, and physicians were satisfied. They said patients weren't bringing them more questions, they were bringing them better questions. So that whole dialogue was more well-informed and more well-prepared.
So that's interesting. So you start with the end goal in mind, right? Which is what do you want? And then you back into it through your process.
Correct. And I'll give you a couple of examples. So we had a woman who she had an advanced cancer, and she was most interested in playing the piano for the rest of her life. And so by understanding that up front and being able to take that into her healthcare team, they were able to prescribe a treatment course for her that would preserve the use of her fingertips so that she could then play the piano.
Wow, that's special.
Yeah.
Yeah.
It sounds like that program really elevates one's level of care and their life while they're going through care.
Yeah, absolutely.
But I want to talk to you about this term that we see, it keeps cropping up. We're hearing it from oncologists and from cancer patients as well. Distress screening. So we're hearing this all the time, and I know that you have a program called Cancer Support Sources. So can you tell us about, what is distress screening and how does Cancer Support Sources help with that?
Yeah, sure. So we know from the Institute of Medicine, they, over time, have issued essentially 5 reports talking about quality cancer care. And there was one issued in 2008 that specifically identified that somewhere between 40 and 50% of all patients have some level of emotional distress, whether it is social, whether it's emotional, whether it's financial distress. So we have worked hard to try to better understand that through our research and to put a program in place called Cancer Support Source that helps us identify the reasons why a patient would experience some level of distress early and be able to work with them to manage that distress before they actually move into having a clinical diagnosis of depression or anxiety. So we've done a lot of work on that. We've worked with organizations like the American College of Surgeons Commission on Cancer, which accredits 1,500 cancer centers throughout the United States, to get distress screening integrated into their overall care plan for patients that are seen in their institutions. What we learned from that is if we can minimize distress early, it reduces overall cost to the healthcare system, but most importantly, improves patient outcomes, which is what I think we're all really interested in.
Of course.
Yeah. And do you guys have any other online or telephone support services as well?
We do. So we have our network of affiliates that we talked about, which is now 170 strong, 50 brick and mortar facilities, and then we have satellite clinics throughout hospital systems and in federally qualified health centers. We also have a telephone helpline that is staffed by licensed mental health professionals Monday through Friday, 9 to 9 Eastern Time. We also have online support communities, so if you don't feel well enough to go to an affiliate and want to join an online support community, which has been demonstrated to be as effective as a face-to-face support group, those are available all on our website. And we also have a live chat feature. So if you are someplace where you can't talk freely, maybe you are getting your chemotherapy, but you just want to have a conversation with a mental health professional, you can go online and do that. So all of that information is available on www.cancersupportcommunity.org, and the telephone helpline number is there, but I'll mention it quickly. It's 888-793-9355.
Fascinating. So tell me more about these affiliates. So you've got brick and mortar. They're across the country or maybe globally, right?
Right.
And so do the affiliates provide kind of a standard set of options when you go to each affiliate, or do some specialize in different things?
Yeah, so each one is unique to their community. However, the basic offering is the same across the world. So they provide, frankly speaking, Anything that they roll out is evidence-based, so they use our models, evidence-based training, the cancer support community models. Patients there have access to Open to Options, they have access to Cancer Support Source, they have access to the Cancer Experience Registry, but they might tweak it a little bit for their community. So a social event might be unique to a particular community, or their partnership with local resources might be unique to a particular community. The cancer support community, because we service patients with and caregivers with any type of cancer, often is the convener within a community or even nationally. So you'll see shared programs with maybe the local Komen affiliate or the local Pancreatic Cancer Action Network affiliate, because we're all here to serve patients and we have a common goal of improving patient outcomes.
Yeah, wow, fantastic.
A big way of improving patient outcomes is developing a registry. And I know this has been a very exciting year for cancer support community, rolling out your patient registry. So can you tell us what kind of tumors are on it? How does a patient come to be on the registry?
Yeah, we're really proud of the Cancer Experience Registry. So it is called the Cancer Experience Registry. It's very simple. So I would encourage your viewers to please become a part of the Cancer Experience Registry at cancerexperienceregistry.org, and also caregivers, because we do have a registry open for caregivers. And let me just tell you what it is. So we know from research that patients, number one, want to give back by helping all of us understand better what it is that they're experiencing in their journey. So in 2013, we launched the Cancer Experience Registry to understand that better. It's a pretty robust set of questions that patients can go and help us really understand. What are you experiencing when you're having that conversation with your healthcare team? What does your financial situation look like, and what's driving that? How do we need to think about how we're communicating your tumor markers, information about your chemotherapy, whatever that is? So patients go into the Cancer Experience Registry and they complete a set of questions. If they are part of one of our subspecialty registries, and we have 9 of those open today, we have an additional set of questions that we have put in place alongside a panel of experts. So to your point about personalized medicine, we are really drilling down into what are those issues that are important to you as a patient living with melanoma, for example. What that allows us to do is then query that data and present it universally, so that anyone who's working in this cancer space can create solutions that would be helpful. I'll give you a quick example of that. We presented at a major medical meeting in December. We actually had 6 presentations over a course of 6 days, during these medical meetings, and we learned around clinical trials. So there is a global problem with clinical trials in that only 3% of patients with cancer who would be eligible to participate in a clinical trial actually do, right? So we're only getting 3% of all eligible patients. Yet, the science is more advanced now than it's ever been, right? The opportunity to find a cure for cancer or to find solutions to cancer are, it's greater now than it has ever been. We learned from querying patients in our metastatic breast cancer registry that we lose 22% of patients from the beginning. They won't even think about going into a clinical trial because they don't feel like they can fulfill the logistical requirements of the trial.
Sure.
Right?
Yep.
So right off the bat, we're losing those people. Furthermore, they tell us that they have perceptions about clinical trial that are just false, given where we are today.
Right.
Guinea pig, placebos, all of those things that just don't exist in clinical trials today. So we at the cancer support community are working with some of our partner organizations to create frankly speaking, about cancer, cancer clinical trials, right?
Yeah.
To help really put good information in the system about what can you expect in a clinical trial, what questions should you be asking. And that's a direct learning from the Cancer Experience Registry. One example of how we do that. The other thing I'll just quickly mention is we try to keep our participants engaged in a community. So once you become a part of the Cancer Experience Registry, we will come back to you to ask you for more information as the environment starts to change. Or what do you think about this new reimbursement structure? Or what do you think about this new educational piece? Is it meaningful? Is it important to you? So we really do have this community that's now been established online.
Well, that feedback loop is so important, right? Because if you get them there, you've got to keep them there.
Correct.
And the more you know about them, the more pointed and targeted content you can push to them, right? And be very specific about what you're pushing to them, what you're targeting, how you're helping them individually through that journey. So the registry is phenomenal.
Right.
You're doing great work around that area.
Thank you.
Let's shift gears a little bit. Let's talk about research and training. what's fascinating to me is you've been able, and with your organization, to corral, for lack of a better term, a lot of different stakeholders, right? You've got, of course, the patient and the caregiver who's at the center of our healthcare system. You've got a team of healthcare professionals. You've got advocacy groups. You've got foundations. You've got all these people, and sometimes, you know, they're not always aligned. But I think what you've successfully done is you've brought them together to focus on the patient and a common goal. You know, how have you done that?
Well, I think the Cancer Experience Registry is a really interesting way to do that, you know, because at the end of the day, where we all intersect is at the patient level. And we are all interested in creating meaningful solutions that would help patients and their families along this particular journey. So you're right, we have become a convener of organizations, and we do have insurers at the table and healthcare professionals, to your point. And we don't always agree, and the players don't always agree, but I think that we've been able to create an environment where it is a safe environment.
Yeah.
So we can have good and meaningful conversation. It's done a lot of times through research, it's done a lot of times through public policy, but at the end of the day, it's because we are all able to sort of focus on our true north, which is the patient.
Sure. We're going to shift a little bit to something that I'm very passionate about. So at Healthio 360, we coined this term virtual social therapy. And we really believe that patients and caregivers who engage in virtual social therapy demonstrate better clinical outcomes. And I know you and your organization have done quite a bit of research on the social and emotional aspect of online communities. You've done some research. What are you finding to be true?
Well, I'm going to give you really a pivotal study, the results of a pivotal study, and it was not done in online communities. It was done in face-to-face communities by Barbara Anderson at Ohio State. She looked at women with breast cancer who went through the intervention of an every other week support group for 1 year. She followed them for 13 years. So kind of put that in your mind. 1 year intervention, she followed these women for 13 years. What she found is that people who participated in the intervention, social and emotional support, had three key findings. Number one is they had a 50% reduction in their risk of developing a recurrence of their breast cancer. Okay? Of those who did develop a recurrence of their breast cancer, there was a 50% reduction in those women dying from their disease. And of those women that did die, there was a survival advantage of 1.3 years. They lived 1.3 years longer than the women who weren't in the intervention arm. I share that with you to say we've been also able to demonstrate that online communities have similar effects in terms of reducing distress, increasing confidence, and being a part of the social network as face-to-face communities. So we would be able to make the assumption that those results would also convert into patients who participate in online groups or online interventions.
Sure.
Well, Linda, I really like how the cancer support community brings together these three pillars. And I want to take our remaining moments and discuss policy and advocacy, which is of equal importance to the other two, but I can imagine that it can't be a very easy one. So, you know, how are you working with policymakers to help transform the social and emotional support for those who are touched by cancer?
So we're doing a lot in public policy. Thank you for asking that question. We feel like what we've been able to do is take the heart of the organization, our service delivery arm, the head of the organization, our research and training institute, and share those experiences with policymakers at the state, local, federal levels, at the regulatory, in the regulatory environment. And we've been able to do it through a number of ways. Number one, convening organizations. Most importantly, bringing data to that table. So when we're talking about a particular issue, and distress screening is one that we're working on, and how to seamlessly integrate distress screening through the clinical trials process, we bring patient stories, but then we also bring large evidence cubes to the conversation. So it is sort of the macro and the micro level in that particular conversation. At the cancer support community, we're really focused on three areas. Number one is access, number two is quality, and number three is maintaining the integrity of research. So when you see us lobby on an issue or educate around an issue, it's typically a part of one of those three core pillars, because we believe that it is a fundamental right of patients with cancer to have access to comprehensive quality cancer care as a whole.
Yeah, fantastic. So the elephant in the room is the cost of health care.
Yeah.
Now, I've done a lot of work following the healthcare dollar through the system to see who siphons off what portion of that dollar. And it's amazing. I'm not going to get into the research here today. We don't have enough time. But what are you finding? How are you working with policymakers and other stakeholders, insurance companies and hospitals and closed system networks? How are you working with those stakeholders to really help, one, manage the cost of healthcare, especially in oncology, and two, ensuring that patients and caregivers don't end up in this financial tailspin because of the cost of healthcare?
Yeah, well, thank you for putting me in the hot seat with that question. And we do a lot of work, and we do a lot of study on that. And unfortunately, we know that a number of patients with cancer are going bankrupt. They're foregoing things that would improve their quality of life, like time with friends and family, simple things like going to a movie, having to make decisions between putting food on the table or paying for health care. And that is just something we believe shouldn't happen in 2015. I think that we can all agree on really two things. Number one is that the rising cost of healthcare isn't sustainable, right? And number two, we can't continue to try to fix that on the backs of patients. And right now cost sharing continues to be pushed on the backs of patients, which at the end of the day is either throwing them into bankruptcy or making them walk away from their particular options. So what we've been trying to do is number one, understand it. So we've done a lot of research, again, results available on our website on patients' access to care today. We've learned that they have concerns about out-of-pocket expenses related to health insurance premiums, related to co-pays on services. So, how much out-of-pocket are they paying for a physician visit, which is different if they're seeing a specialist or a primary care physician. What is the cost to them if they are getting an x-ray, follow-up x-ray or lab test, which can vary widely across points of care or sites of care, and they're concerned about out-of-pocket payments for drugs and other treatments. So that's sort of what's driving their concern. What is interesting is that when you look at distress, to your point earlier, 71% of the patients in our Access to Care study said that they don't have access to psychosocial support, or they weren't offered psychosocial support. So the very thing that could help them navigate this whole cost structure, they don't have access to, or they feel like they don't have access to, which is something that we're trying to shift.
Yeah.
The other thing that we're really doing is to try to really hold people accountable to the conversations that we're having around this issue. Because it's not just one point that's driving the cost of care, it's across the system.
Exactly.
Yeah, it's across the system. So we're trying to have meaningful conversations with all stakeholders to try to really break that down, understand better their point in that driving of healthcare costs, and how we can work with them meaningfully to fix that.
Yeah, great. Well, thanks for coming in. Unfortunately, that's all we have time for today. Linda, as somebody whose family's been affected by cancer, I want to thank you for all the work you and your fine team are doing down in D.C. Keep up the great work. Thanks again for coming in. I'd like to thank the viewership for tuning in. And last but not least, I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthyo360.com. Our podcast can be found in the iTunes Store. Healthyo360 can also be found on Facebook, Instagram, Twitter, and Pinterest. Please don't forget to use the hashtag #RealStories when posting. So on behalf of myself, Cortland Long, and everyone here at the Healthyo360 family, we hope you have a very pleasant afternoon, and we look forward to seeing you again next week.